So one patient story in particular that comes to mind is a patient I had a few years ago who was actually a new patient for me. He came in with what seemed to be a fairly straightforward sinus infection. As I was examining him, I noticed that his thyroid seemed to be a little bit larger than what it typically should. He had no history or didn't know of having any problems with his thyroid. The next step was to send him for a thyroid ultrasound to make sure that he didn't have evidence of thyroid cancer or nodules or anything like that. On the ultrasound, they incidentally found that he actually had carotid artery stenosis, which is the big artery that gives blood to your brain. He eventually, going through more testing over the next few months, ended up having a surgery to clean out that artery, which actually we do that to help prevent patients from having a stroke. Fast forward a few months later, the patient came back to follow up with me after he had had these surgeries, and he was so grateful and appreciative to me for finding that, because we were actually able to prevent a stroke in him. And he later told me that one of his biggest fears was having a stroke because his mother passed away suddenly of a massive stroke, and he was really worried about that. This story, I think, goes to show how important it is to make sure that you're having those regular preventative screening things done, making sure that you're seeing your doctor at least once a year to make sure that those things, if we can find them and help prevent those things from happening, just like what happened with that patient, we were able to prevent him from having a massive stroke by simply him coming in to be evaluated for what seemed like a routine sinus infection.